Case presentation is an interesting animal. Everybody's got their own method, their own thought process. There have been books and articles and seminars devoted completely to case presentation. But you know, the best case presentation is really no planned presentation. It's a conversation. I wish we could call it a case conversation, because wouldn't that make more sense? There's an old axiom that says never work on a stranger. That doesn't mean only invite your friends to your office. It means don't start working or even a case presentation on a person that you just met. Get to know them a little bit. I don't mean you got to go out to dinner with them, but spend 5 minutes finding out what motivates them. Why are they there in your office? What is going on? What's happened in their life? What's happening in their mouth that causes them to finally want to come in? And I'm not talking again about the person that comes in for a routine checkup and you find out they've got a cavity or need a crown. That's not a case presentation. You know what I'm talking about. Somebody that needs a full mouthful of something or a large grouping of things that have been neglected or ignored, or the person hasn't been to the dentist a long time. So let's call it a case conversation. I want to tell you what doesn't work. I had an associate, I'm going to take my glasses off for this, that worked for me. And the first time he would talk to a patient about their dental needs, he would have spoken to him for a couple minutes first to introduce himself. He'd do his exam, and then he would sit down in his chair next to the patient and literally do this. Well, I don't know. I guess we could start. Does anything hurt? Yeah. We'll start on the top. Like, that was his style. The first time I heard him do it, I about fell out of my chair. Of course, we teased him about it for the next 2 years. But eventually I taught him not to talk to people that way. And I gave him the example of Star Wars and Yoda. He was talking about maybe we could try. He said try an awful lot. You remember in the very first Star Wars, I'm sorry if you're not a fan, but you should go watch it if you're not. In the very first Star Wars, when Yoda is trying to get young Luke Skywalker to raise the fighter jet thing out of the swamp, and Luke had given up and finally says, all right, Yoda, I'll try. And Yoda stops right there and says, no, do or do not. There is no try. And that's a huge communication thing. We're not going to try to put a crown on your tooth. We're going to do it. We're not going to try to extract a molar that's got to come out. We're going to do it. Right? There's no try. So in your case presentations, or again, let's call it a case conversation, don't talk about trying and maybe and could or would or should. Here's what you have. Here's what needs to be done. In my case conversations, I am very clear about the words needs and wants. So much so that I tell the patient, I'm careful about using the words needs and wants. And what you need in your mouth is, and I lay it out. So you may have some other wants, perhaps some cosmetic issues, a little straightening, a little whitening, whatever. So I'd be happy to address those. But I'll need you to tell me what those are, because I'm not going to try to sell you a bill of goods beyond what you actually need. And if there are some alternative solutions to what you need, I'll be happy to explain those as well, and what level of compromise those other solutions may carry. Do you notice the words I'm using? Needs, alternative solutions that carry compromise. Pick the words that you're going to use carefully. I'm big on using two very non-offensive words to let patients know that they are in control of their case plan. And it's the words budget and schedule. I'll say, Mary, it's clear that you're going to need 3 crowns and the 3 teeth that we discussed. We can get to those as fast or slow as you like. It really just depends on your schedule and your budget. You can talk to the scheduler up front and get that taken care of however you want. Though I'd never say, if you can afford it, that's offensive. But we've all got a budget. I've got a budget. You've got a budget. The United States has a budget. They just never adhere to it. But there's a budget. The patient knows what they can afford. Maybe we can help them work it out over a monthly basis with care credit financing. Maybe they're going to do one every 3 months. Or I'll go back to my roots. My mom had 14 crowns in her mouth by the time I graduated dental school. Now she has 15 because I got to do the 15th one. We were not wealthy by any stretch. We were very middle America, 2 blue-collar working parents. My mom needed crowns, and our dentist, Dr. Engel, wonderful man. Steve Engel, if you're out there, how are you? My mom was in the Crown of the Year Club. She could afford to have 1 crown done, and she had the worst one done each year for 14 years. And there I was for the 15th year, and I got to do the last one. So there's a budget. Find out what the patient's budget is. Not personally, let someone else find it. Let your front desk people find out what it is. But use non-offensive language. These are your needs. These are alternatives. They're compromised in this way. Am I still comfortable doing those compromised solutions? Sure, as long as you understand it. I wouldn't let you do any treatment that was substandard. These all meet the standard, although there's a level of compromise. Listen to that vocabulary. And then we can take care of your needs at whatever works for your schedule and your budget. Put the patient back in control. And don't act like you're an idiot. This whole business of, I don't know, maybe we could. You're the doctor. If you don't know, who does? You have the training. You have the expertise. I teach a whole hour on this subject, and I would love to have you hear that. But for the purpose of this conversation, know that it's a treatment conversation, not a treatment presentation.